Welcome to this series about studying and learning skills for undergraduate medical students. My name is Mohamed Hassan Taha. I am the director of the Medical Education Center at the University of Sharjah, and we have developed these videos to support the learners, undergraduate medical students, and postgraduate with their study skills and learning skills to study effectively in the College of Medicine, Dental Medicine, and Health Science. Today's video will be about problem-based learning, the 7-jump approach, how to learn in problem-based learning using this 7-jump approach as a student. I encourage you to watch the previous 2 videos in this series. The first one was about problem-based learning, the principles, and the second one about your role as students in problem-based learning. So the video will be about the 7 step in problem-based learning, or 7 jumps. So these 7 jumps in 2 sessions. The first session, in the first session, the 5 include the 5 jumps. Start by clarifying the terms, defining the problem, analyzing the problem, then doing the summary, formulate the learning issue, then self-study and clinical sessions in between, and then reporting back to the group. And here the steps. This is in session 1, basically as brainstorming, then self-study, and then session 2. Let us go through the steps. This case scenario related to a newborn baby had a cataract and deafness. Obstetrician asked the mother if during the first few months of her pregnancy she had suffered from disease or had taken any drugs. The mother said she had fever, malaise, and skin rash in the 3rd month of pregnancy. At the time, she had consulted a doctor in the nearby health unit, and the doctor told her it was probably some sort of allergy and nothing to worry about. She then prescribed some pills. I have to declare that we developed this case scenarios 10 years ago at Qasim University in Saudi Arabia with our colleague, Professor Aith, Professor Mohamed Noor, and Dr. Magid Wadi as part of a training workshop in problem-based learning. So we receive a case scenario as this. And as a student, you will ask, so what do you think are the terms that are difficult? The first step is to clarify the concept and identify the difficult term. Maybe as undergraduate medical students, first year of the program, you identify this as a difficult term. So you highlight the difficult term. What to do with them? You ask your colleague. You can open the dictionary, textbook, internet, and one of the group members look for the terms, and then the members try to know the term by themselves, but not asking the tutor. So this is a difficult term. The second step is defining the problem. Let's go to the second step. Then here the case scenario. What are the problems here? Defining the problem in this case scenario, there is a problem related to the baby with defect in eye and ear. Also, there is a problem related to the mother, including skin rash, fever, malaise in the first few months of pregnancy, and possibly due to allergy, pills, or during the illness. So a scribe should write in the board these problems, and it should be clear in a separate box. Now we complete the second step. Let's go to the third step, which is analyzing the problem and brainstorming. So the first problem, baby born with defect in eye and ear. And the second problem, mother had skin rash, fever, malaise in the first few months of pregnancy, and possibly due to allergy, pills taken during illness. So, and here Analyzing the problem is brainstorming between the group members, not from the tutor. So we'll ask this question: why this happened, when, how, where, and so on. And these are a very important set of questions that can, between the groups, can help to understand or to do the brainstorming. Questions like this: why does the doctor ask the mother if she had some illness during the first months of pregnancy? Will this affect any illness during the early weeks of pregnancy? Can cause problem to the mother and to the child or to the fetus? If there is any link between the illness of the mother had during the pregnancy and the defect of the newborn, does maternal disease occur during the first few months of pregnancy cause a baby to be born with birth defect? Do drugs taken during pregnancy affect the fetus inside the uterus? Is this a problem if the drugs taken during the first few months of pregnancy or at the end of pregnancy? What are such defects called? So this is a very important question to be asked in brainstorming phase. Now we'll go to the fourth step or fourth jumps, which is related to problem analysis and systemic classification of the problem. And here the step in which the student should think about the initial concept map. And it's very important now, after developing, writing in the boxes, this the result of the brainstorming is to arrange the explanation proposed in a logical sequence. A lead to B, and B lead to C, and C has connection with A and B, and so on. And each group member may produce different explanation and different sequence of events, and this should be between the group members, not with the tutors. And maybe ask these questions. Maybe the mother had a bacterial infection, and bacteria may have crossed the placenta to affect the baby in the womb. Or maybe the mother had a viral infection, and the virus may have crossed to affect the baby in her womb. Or maybe an infection occurred, but the microbes did not cross the baby to the baby. Perhaps it was just the raised body temperature in early part of pregnancy which may have hurt the baby. Maybe the development of the body is occurring more in early part of pregnancy. So for this reason, congenital anomalies take place. So students may ask these questions, and it's free to ask any questions here. It's very important to remember that the third and fourth step are the most important step in the first session of PBL, and it's very important to have prior knowledge is being activated and possible explanation is made and gaps in knowledge are identified. Then the end of the first session should be formulating the learning objective. And the learning objective could be maybe related to birth defect, their causes. Do bacterial, viruses, or parasite cause birth defect? What one do so, and what is the mechanism? Do drugs cause birth defects? If so, what is one? Is early part of pregnancy more important in such defect, and why? So this could be the learning objective. And please bear in mind that one of the common practice and malpractice actually in problem-based learning, students think about learning objective in discipline format, about histology of the maybe anatomy of the uterus, anatomy of the physiology of pregnancy, pathophysiology, and so on. No, the learning issues should be closely related to the problems rather than discipline format. This is the end of the first session. Then we'll go to the sixth step, which is about self-study, learning from different resources, and so on, and the final step about the discussion. Now we'll go to the sixth step, or to the jump number 6. So most of the learning take place here, because the first session basically for discussion, brainstorming, and identifying the gaps. So the learning will take place here. And in the sixth jump, it occurs in the time between the first session and the second session. So if the first session is on Monday, the second session might be on Thursday. Or it depends on the schedule of the medical school. or the health science school. Students get most knowledge here and understanding in the sixth camp. And they can learn from book, from internet, only authenticated website, from their peers, seniors, experts, and resource faculty. So the sixth step. Now let's go to the seven last step. So this step take place in session 2. In a summary, in session 1 we have 5 steps: clarifying the difficult term, the concepts, then defining the problem, then brainstorming, initial concept mapping by systemic arrangement of the phenomena in boxes, and then the learning issues. Then in between, self-study, learning from clinical sessions, maybe bedside session in some schools, seminars, lectures, and then here the second session, which is the 7 steps of the 7 jump. So here, the aim was to share information with the group and to fill any gaps in the concept. It's very important to try to integrate the knowledge acquired into comprehensive explanation of the phenomena. And this actually not done well by the student, which lead to disconnect between the problems and the problem acquired. And this opportunity here to apply the knowledge, to understand the problem, and it's missed because the students just start by the objective. It's very important here to highlight, in many programs, students start with listing the objective and then start discussing the objective. No, students should start with the problem and with the patient scenario again, and then go to the objective and then move forward. It's very important to avoid mini lectures. Some students come to this session. One of the also not good practice to make these sessions as mini lectures or as presentations only based on the objective they identified. No, you should start with reading the problem. You should start with the learning issues, the learning objective, and then discuss the learning objective and the learning issues. Bear in mind that all the students need to be actively involved, and you should focus on what still needs to be clarified. It's very important to sharing preferably material learned by one member, which part is valuable or which shed special light on the topics and so on. Can we use presentation and slides in problem-based learning? Because here we said that we should avoid mini lecture. Yes, the answer yes, but we should use them as visual aids. For example, if you want to describe diagram, figures, X-ray, pictures, and so on. But don't a complete set of PowerPoint presentation. It's very important to read without note and share what we learn. Sharing information is the key, and we should use the group to develop communication skills. This is a time to learn from each other. And it is very important for everyone to communicate effectively, not only technical information, but also the feeling of personal level. And remember, some of you may have some personal problem, and this is a time to overcome this personal problem. And we have to explain always the sense of the scenario. How we'll do that? For example, when you come back to the group ready to explain, what do I know now? What is I still don't know? Can I illustrate it? You can draw a diagram, show a chart, show a table, and you can ask yourself, how do I know this? You have to explain why it is relevant to all this case scenario. What is the pathophysiology? What is the mechanism? What is the relevancy? Why this is important for my practice in the future? And you have to use evidence and critically appraising yours or other people asserting. You have to work toward synthesis of the knowledge. You have to synthesize what you know now with the scenario, and it's very important to make a concept map, which is absolutely complete by explanation of the phenomena. It's very important to explain without note. Why? Because if you really know it, have not just made note on it, you should be able to communicate it and its clinical relevance and provide evidence, argument to support challenge assertion. This is very important. And as students, we should never start this session by by forgetting the patient. Always start by explaining what happened to the patient, to his body or her body, the sign, the system, symptoms, and this is every week. You keep rehearsing what you know in a clinical context, and this will make it easier to recall later in the future, because problem-based learning is a design by the design. It is one of the authentic learning approach that is very relevant to the practice. Okay, some students, they start with this way. We don't encourage you. It's not beneficial for you to learn from problem-based learning if you start from and using this way. Some students start with, okay, will someone speak about the histology objective? Who want to tell us about the anatomy objective or pathology objective? This is not the right way to start the second session of problem-based learning. If you do that, you are losing the very essence of problem-based learning, which is learning in context of a patient problem. You must first talk about the patient problem, and then, using the knowledge of basic subject, try to explain what went wrong in the normal to give rise to the abnormal. For example, Karim was a smoker, and the nicotine in the cigarette smoke caused repeated irritation to the bronchial mucosal epithelium. The normal epithelium is pseudostratified ciliated columnar, and the function of this epithelium is to push out foreign substance, bacteria. Now explain the histology of the normal lining and so on. So this is an example of how to start rather than just discuss the histology of the epithelium and so on. Very important, for every objective, refer to the patient again and again, not as objective alone, because learning should be within the context of the case scenario. You are allowed again to use slides, PowerPoint, but only for chart, tables, figures, diagrams, X-rays, graphs, curve, videos to explain and explore normal and abnormal. But you are not allowed to bring text for projection in PowerPoint and reading from this. This is very important fact. Avoid the key message, avoid the mini lecture in this session. Evaluation is the key at the end of this session. You should evaluate yourself. Did I do enough during this week? Evaluate the group. How did we do? Evaluate the tutor. How did our tutor do? And remember that the tutor in problem-based learning session is the facilitator, not a teacher. If she or he is giving you explanation or gives answer to your questions or keeps talk, most of the time he is not or she is not a good tutor. Thank you so much for watching this video related to 7 steps or 7 jumps in problem-based learning. I wish that this series of videos were helpful to you and you learn a lot from these videos. And I wish you all the best and successful study in your university. Looking forward to seeing you in another series related to learning and related to research in undergraduate and postgraduate medical education.